My knee, as it became more and more of a problem, slowed me down in a number of things. I couldn't get out of the bathtub. I couldn't even get into a bathtub. Even in my sleep, the pain was just terrible. Other doctors had tried injections. Nothing worked. It just kept getting worse and worse. And that's when I started to look for Dr. Kraus.
Mr. DeLuise is in his young 60s, and all of a sudden he comes to my office, and when I meet him, he's a 63-year-old person in an 80-year-old body. He says that his knee is so painful and so debilitating, his quality of life is eroded away. He's using a cane at 63 years old. He's unable to walk more than a block without a lot of pain. And he's had conservative treatment. He's had injections, he's had physical therapy, none of which was helping him. You look at his x-ray, he's absolutely bone against bone. He has no cartilage. And he's the perfect candidate for a knee replacement.
I'm very pleased I picked Dr. Kraus. He answered all my questions, and that's when I decided to go through with this and have my knee replaced. At Syosset Hospital, every step of the way, I felt that I had a whole team that were really on my side. Nurses, physical fitness people, PAs. Somebody watched out for me every minute. I had never experienced anything like that. 100% feeling that everybody was there just for me. The morning of the operation, Dr. Kraus and his associate came in and talked to me, explained to me what was going to go on. I woke up and the operation was over. So that part of it was easy. My leg was, different. There was a bandage on it. And they brought me to my room where I was going to stay for 2.5 days.
The physical therapists come to the patient's bed 4 hours after the procedure. The goal is to get them functioning as quickly as possible.
The PT came in and said, okay, we're going to stand up. And I go, I really don't want to do this. And got up and I took a few steps. I just couldn't believe that this knee was able to, a few hours after the operation, move. But I knew right then that that bone-on-bone pain was gone already. Had my operation on a Wednesday morning and I left Friday afternoon. As I went through those first few days, and by the time I was ready to leave rehab, I was walking. I could walk up and down a staircase. I hadn't been able to do that in a year.
Here's a person that, threw away his cane and can go back to doing everything. He's full of life.
I'm walking along the beach, walking up and down stairs. Walking to me is what I need. It gave me my life back. It was like a miracle.